Sorry, I was muted. Good afternoon, everybody. So today we would be talking about medications and understanding the cost and optimizing the lifestyle. So this is a series of wellness pep talks, and thank you very much for joining, and hope you can get most out of it. We would also be making little clips of it. So if you feel like there is other people who have not reached out, or this webinar has not reached out to them yet, and they would benefit from it, you can send that clip out to them. So let's talk about, can I get the next slide, please? Next slide, please. Can people hear me?
Yes.
Okay, next slide, please. Okay, so health equity means that you've probably heard these buzzwords. So on these wellness pep talks, we're going to be talking about what these what some of these buzzwords are that are being talked about in the media and the healthcare settings, as well as how does worry-free community responds to the challenge of health equity. So let's look a little bit deeper into the word of health equity and what really that means. So it means that everyone has equal access to the highest possible quality of care at the lowest possible cost. Now, the triangle that you see out here, it's called the iron triangle of healthcare. And it is a challenge for almost every country who tries to give benefit to their citizens as a healthcare as a right, that their challenge is to provide equitable access to healthcare to everyone that is a resident of that country. However, for those of us that are living in the United States, this iron triangle looks something like our next slide. Can we have the next slide, please? Okay. Um, so do you see this is a little skewed here. And so the actual triangle, instead of being balanced, we actually have poorer quality of healthcare, restricted access for the residents of the US, and the cost is too high. So some of us have access to Medicaid, some of us have access to Medicare, some of us carry employer insurance, some of us have to buy health insurance from healthcare.gov. So not everyone has equal access to healthcare. And we do talk about universal healthcare or universal access, but we are really far from it. So in some, if you live either in Cook or DuPage County, you probably have heard of the fact that some of the Cook County and DuPage County uninsured rates go as high as 14 to 20%, which means that when you are in a group of 5 people, one of the person out of that is uninsured. So not everywhere, but that's the challenge within Cook County and DuPage County. And that is indeed a big challenge. So how do we exactly work with, or what do we exactly do, and how do we answer that challenge? So next slide, please. So knowing that, can you guys be more proactive in forwarding the slides? Thank you. I'm sorry, I don't have controls today, so it's a little off. So knowing that that is a challenge, the healthcare triangle is skewed. How do we help with expediting health equity? How do we make sure that people have equal access to healthcare? How do we make sure that people are paying not overly exaggerated prices in healthcare, right? So when we started Worry-Free Community, or the way Worry-Free Community came into being is we started helping people with health insurance and finding them their medical homes. So insurance coverage on one hand and clinical care on the other hand. So what we were facilitating the people without coverage into with their medical homes, and finding out what matters to people, what matters most for them. So that really gets down to uh, community health surveys, patient-centered surveys, and those are the three main programs that we work with. We have another program coming up, but these are the three programs that we work with: health insurance on one hand, clinical care on the other hand, and then finding out what really matters to people, what can we provide to them so they can best out of their clinical care as well as insurance care. So there are many, many factors. When we were finding out that what matters to them, there are many factors that actually work with or play in the role for what matters to them. Next slide, please. So when you look at this particular model here, it's called a county health ranking model. Some of the details about how these models have come about and what do we actually do a healthcare orientation, which is a 4-hour course we do it I personally do it over the weekend. So if you'd like to know more about any of these models, you're more than happy or we would be more than happy to accommodate you over the weekend. So when the invite comes out to you, please RSVP and register, and these are free of cost to the community. So going back to the county health ranking model here, that if you see that all of these factors are called health factors. There are 13 health factors that directly impact the quality of our lives and the length of our life. But if you look at the clinical care here, that this is where your health insurance is and your clinical care is. That's only 20%. So the rest of the factors according to the county health ranking model, has nothing to do with your health insurance and your clinical care. So the health equity, when we want to talk about it and we want to do something about it, very little goes with health insurance and with clinical care. What happens to the rest of the 80% of the factors? Now you see the map here. If you look there, that all of these red areas have higher disparities than the blue areas. So this is the challenge that we have. And ideally, we would like the whole country to be dark blue, but we are far from it. So what we when we talk about bridging these gaps, we talk about learning about these factors and making sure that we work with, or we establish these volunteer programs where we train the volunteers in health coverage skills and clinical care skill sets to tackle the social determinants of health. So these factors are called social determinants of health, but the healthcare is affected by it, but it's not delivered by it. Two different things. So what we are doing is we are teaching our volunteers through this volunteer training program as how to take care of people that come to the clinical care setting, because that's where healthcare is delivered. So most people go to a doctor to find a cure for anxiety or a headache. However, the solution for their headache and anxiety doesn't reside in the pill. It's outside the pill, right? So therefore, we need to look at the social determinants of health in order to help them out. And we have established a community health volunteer program where we are training the volunteers in basic health coverage skill sets and clinical care skill sets, and helping them understand how to tackle the social and clinical issues at the community level. They learn about social determinants of health and become competent with working with health disparities. They can also help mosques, or we are also helping mosques to train the volunteers in healthcare programming, so many people at the community level can get helped. You can also join a community health training program as well and you can also help out with expediting health equity. And in the next slide, you can actually see that our volunteers are hard at work with helping people out and hosting the outreach sessions as well as working in the clinic. We actually take as young as high school students and go as high as the resident in the at the medical residency program. One of our clinic in the Oak Lawn, where the medical residents come in, they actually get trained in community health through our program. Next slide, please. So the volunteers really are the fulcrum that would help balance this both coverage and clinical care, because they take from the community what matters to them the most and work with the social determinants of health to actually promote that. So next slide, please. So now, what exactly is a wellness pep talk? The purpose of this particular webinar is to help people with their wellness and healthcare questions. And we will have at least two guest speakers every session that will cover high demand topics such as cost of prescription refills, which is what we are covering here in this webinar, and also how to change one's lifestyle in achieving wellness. We're actually going to be having 10 webinars on a monthly one each month we will offer. We won't have a webinar in the month of March because of the Ramadan, but in April we will inshallah resume back. Next slide, please. So today we have, I will be now inviting our guest speaker, Shahina Ali, who's a registered nurse. She carries over 20 years of experience in nursing and case management at Blue Cross. And for the past 15 years, she enjoys helping patients make lifestyle changes. So, and then Moina Hussain will follow her talk. And Moina has been a health coverage consultant for the past 10 years, since 2013, after Obamacare came in, or healthcare.gov open, and she's an expert in Medicare, Medicaid, and ACA. She actually had helped set up two SHIP sites. SHIP is a senior health insurance program at the two-partner nonprofit organization, and has been providing patient navigation services since 2013. So without further ado, I would like to invite Shahina to present us with the lifestyle factors and how to do the lifestyle changes.
Okay, thank you, Fatma. I'm Shahina. I'm registered nurse and case manager, as Fatma introduced me. And good afternoon and assalamu alaikum to everyone. So my topic of discussion is lifestyle factors. And then next slide, please. Okay, so I'm going to talk a little bit about salutogenic approach to wellness. For those who are not aware of it, salutogenesis is actually a combination of two different words, Latin word salus, which means health. Genesis is a Greek word meaning origin or beginning. So salutogenic approach is actually focusing on the wellness, health, and not much focusing on the disease. So as you can see in this picture, in the middle you see stressors. We all have stressors in our life, which could be anything, like, maybe a major life event, a new baby, a divorce, marriage, maybe we are moving to a new place, a new job, a loss of a loved one, emotional health stressors, depression, anxiety. So how you are addressing those stressors, if you are addressing them in a salutogenic way, it's toward your well-being. Otherwise, these stressors can cause tension and go towards pathogenesis, which developing a disease. So we don't want that route. So salutogenesis, that's what we'll be focusing on because it's towards our well-being. Next slide, please. So in this picture, you can see the different stages of the process. So we are focusing on prevention, education, and promotion. If that's not addressed, it can go down the other way, disease, which needs protection and cure. And how are we planning to do it? So how I am going to address it today is making little changes in our behavior, making lifestyle changes. And making little changes to our lifestyle and behavior may result in our better well-being. And keep that in mind that behavior change is not something that can be forced upon. It's a process. A person needs to be ready themselves to make those changes by changing a little bit in their activities, making a little changes in their lifestyle. Next slide, please. So what's a lifestyle? Now, what's our lifestyle factors? So some of the factors that I want to talk about today is maybe physical activity, like what's your physical activity, what kind of activities you are involved in a day, how much of walking you do, how much of exercise you do, things like that. Then nutrition, are you following a well-balanced diet? Is it healthy? Does it have all the components that needed? Your sleep pattern, are you getting enough sleep? Because sleep does affect your health. Are you involved in any tobacco use or alcohol use? So these are some of the life factors. And there are many, but I'm just focusing on these for now. And 1 second. Okay, so as I was mentioning earlier, a person needs to be ready to make any changes, any positive changes in their life. And how do we know that a person is ready? So for next slide, please. Next slide. Okay, thank you. So for readiness check, ask yourself, are you ready to change or improve yourself? And how do you know that you are ready? So there are some questions you want to ask to yourself, like um, how do you know that it's time to make a change? And what qualities are in yourself are important to you that you want to work on? And this stage is usually is called pre-contemplation stage. Like you're not sure, you're not ready. So in this stage, the person is not even considering changing. They may be in denial about their health problem or not consider them serious. They may have tried unsuccessfully in the past and they have just given up. So this is pre-contemplation stage. Then the next stage is contemplation, like after you have assessed yourself and found any quality that you want to work on, and you are contemplating about it. At this stage, you want to know what are the barriers in achieving that quality, what result you are looking for, and and then the next stage is the preparation stage. Like you have identified your quality that you want to work on, you have identified a barrier, what's stopping you. Then you develop a realistic goal. It has to be realistic because if it's not, then you're not going to achieve anything. So something tangible that you can reach, you can achieve, and realistic. And then you create a plan, like an action plan to achieve that goal. The best way to achieve that is to find a barrier and find the ways to overcome that barrier and set the action stage. And choose a specific date that also helps in achieving the goal. And a lot of times, um, when you reach that goal, you have to maintain it. The maintenance is very important because there is a that could be a relapse if you do not maintain it. And again, this is the behavior change is not like a one way street. It's not a single event. It is a process with different stages, as I mentioned, the pre-contemplation, contemplation, preparation, action, and then maintenance. People do progress in both directions in these stages. They will recycle through these stages several times before the change becomes fully established. And for most people, behavior change occur gradually over time. It's not like an overnight thing. It's a process, and people do become uninterested sometimes, unwilling sometimes. Um, but as I said, it's a process. So you have to be resilient. You have to be consistent, persistent to achieve that. And people do move through these stages several times before achieving anything. And anything that moves a person along the continuum towards making a positive change should be viewed as a success. And it's also very important to evaluate a person's readiness to change for any proposed intervention. It is you are most likely to succeed if you do it slowly. It's not overnight. It's a slow, gradual process. Um, yeah, that's all I had. But go to the next slide if I have anything listed there. No, that's all. So that's salutogenesis approach to well-being. I'll be happy to answer any questions you have. But our next presenter is going to be presenting about the medication coverage. So Moina, it's all to you now.
Thank you so much, Shahina. Thank you. That was very informative. And thank you, Fatma, for the kind introduction. Hi, Assalamu alaikum. Peace, everybody. Good afternoon. This is Moina. Like Fatma said, I'm part of the Very Free group. And then I have been working, helping community with questions regarding Medicare, Medicaid, and Marketplace. So what I'm going to do is I'm just going to talk a very basics of drug coverages. Next slide, please. Whenever you have a plan that covers your medications are divided into two categories, formulary and non-formulary. Formulary means that your plan is going to cover that drugs. Non-formulary means that they are not part of the drugs that your plan is going to cover. If your doctor thinks that, or your physician thinks that you need a non-formulary drug, what they need to do is they can contact your insurance company or the plan, and they can request the changes in the basic formulary for you, and then insurance can cover that. Now, basically, when I say formulary, it does not mean that once you have a plan and your drug is part of the formulary, means that insurance is going to cover cover your drug, a specific drug. It will be $0 for you out of pocket cost. Generally, next slide, please. Drugs are divided into three categories: generic, brand, and specialty drugs. And I generally give an example of diabetes, to control diabetes, because this is very common. You can take metformin to control your diabetes. You can take Januvia or Genemet, or you can take injectable insulin to control your diabetes. Generally, metformin is considered a generic brand. A generic Januvia or Genemet is a brand. And then there are specialty drugs that is required if you have, God forbid, some at like a chemotherapy or radiation therapy. At that time, you require the specialty drug. Now, if you have an option, if you wanted to save cost towards your medication, if you have a generic available, always try to get a generic medication rather than brand, because generic will cost you less compared to brand drug. But a specialty, and there are two type of options that you pay towards your medication. One is through copay and the other one is through co-insurance. Generally, for generic and brand drugs, you pay co-payment. Does not mean whatever the cost of the medication is, you pay specific amount, like $5, $10, $15, $20, $30. That is called co-payment. The specialty drugs generally are covered with co-insurance, which means that depending on the cost of the drug, you pay percentage, 30%, 35%, 33%, 40%, like that. Now, if you have, like Fatma mentioned earlier, that if you have coverage through Medicare, if you have coverage through ACA, or if you have coverage with Medicaid, your copayment depends on your plan. Generally, Medicare covers your medication into five. They divide their medication into five tiers. Tier 1 and 2 are generic, tier 3 and 4 are brand drug, and then tier 5 is a specialty drug. And here I have given you some examples of in the chart. If you can see that if you have Medicare, then you pay less for generic, more for brand, and then you will pay more, the most for a specialty drug, and that is generally in percentage. If you are eligible for Medicaid generally you do not have to pay anything for your medication, whether it's generic, it's specialty, or brand drug. Extra help basically means that it's for people who have Medicare and they do not qualify, and their income is less than certain level, they can apply and qualify for extra help. What extra help does, it does not help them with the medical coverage, co-payment or co-insurance, but the extra help helps you pay towards your medication. So if you have extra help with your Medicare, your generic prescription can cost you up to $2. Brand drug can cost you up to $13. And I'm talking about 30-day supplies with this. And a specialty drugs is also up to $13. Next slide, please. Now, there is another concept that you need to understand, which is called maximum out of pocket. Basically, maximum out of pocket means that uh, when you have coverage, this is the maximum you will pay towards your benefits. Now, if you have Medicare, Medicare has a and it's also called MOOP for short. Maximum out of pocket is also called MOOP. So if you have Medicare plan for 2025, your MOOP for your medications is $2,000. Once, whether you take generic prescription, whether you take brand prescription or you take specialty medication, all of that, whatever you pay out of your pocket, the maximum that you will pay for 2025 is $2,000. If your medication plan has deductible, this $2,000 does include that deductible. For 2025, generally for Medicare coverage, the deductible is $590 or less. That is the maximum that you can have. Once you reach $2,000 maximum out of pocket or MOOP, then whether you take whichever category of medication you take, generic, brand, or a specialty, then you will pay $0 towards your medication after you reach that $2,000. Now, if you have coverage through ACA, MOOP works a little differently. ACA, your medication, whatever your medication is costing, is actually considered, or whatever you're paying to get your medication prescription drug coverage, that will count towards the plan maximum out of pocket cost. meaning that if your plan has a maximum out of pocket of $5,000, if you go to a doctor, go to a hospital, خدا نخواسته, or go to a specialist, whatever you're paying copayment, that counts towards your maximum out of pocket, plus whatever you are paying towards your medication is also counting towards that. And once you reach that maximum out of pocket, all your medical and prescription services will cost $0 to you. Next slide, please. That's about it from my end. I just went over it very basic, so I am open for any question and answers or questions or any comments. Otherwise, back to you, Fatma. Thank you so much.
Thank you, Moina. Thank you, Shahina, for this wonderful um, presentation about medications as well as the lifestyle changes. And we are now ready to take questions. If any of you has any questions about any of those two topics, lifestyle changes as well as medication questions.
Assalamu alaikum wa rahmatullahi wa barakatuh.
Walaikum assalam wa rahmatullah.
My name is Saleh Khulagi, and I am the chairperson of the Islamic Center of Omaha here in Omaha, Nebraska.
Okay.
First of all, Jazakallah khair for mashallah. This was a very helpful event, and may Allah reward everyone.
Jazakumullah.
So my question is, I'm not sure. It could be a very silly question to ask. I'm not sure if you guys based in Omaha or somewhere else, but my concern is because we have so many refugee families that come to our masjid. So, is there any possibility to have a on-site event to for the community, as well as we are also looking the avenues to help the community to enroll in the Obamacare insurance, inshallah.
So, Brother Saleh, Jazakumullah khairan for joining, and thank you so much. And Omaha community is really very dear to us. For some wonderful people out there like you, and so yes, we actually have we carry the licenses across for all the states across the nation. We have not done the on-site event in Omaha, but however, we do support over the phone pretty much the calls that come in to us anywhere. And that is part of the reason why we are hoping to teach the community health discipline to the people in different parts across the nation. And we want to start with our pilot mosques here in Chicagoland area, but we could, there are possibilities where we could even go out and host events in other states. So we would love, I would definitely connect with you. I'm sure you have since you registered, you have sent us our email. So I'll connect with you for an in-person event in at your location and what some of those possibilities are, inshallah.
Okay, sounds good. Jazakallah khair.
Yeah, jazakumullah khairun. Anybody else? Moina, let me ask a couple questions about for the with respect to the drug coverage. So if the person maybe may qualify for Medicaid and the doctor prescribed the specialty drug, for example, Ozempic, it's a very expensive drug. And do Medicaid people or Medicaid patients are being is it covering Medicaid patients or no?
So it depends on their category. If they they are under 65 and they do not have Medicare with Medicaid, people who are dual eligible have Medicare and Medicaid both, and their prescription drug coverage is little different than people who only have Medicaid. Now, people who have Medicaid, yes, it is covered as long as the doctor prescribed them. And if Medicaid decided that no, they're not going to cover that, the doctor can request a formulary change for that, and that will be covered. And generally, people with only Medicaid does not have to pay any out-of-pocket cost for that medication. Now, people who are dual eligible, meaning that they have Medicare and Medicaid both, they will pay the amount which is for extra, that is for extra help, with extra help, because people who are dual eligible are generally automatically enrolled with extra help, and the maximum that they will pay. And again, there are different levels of coverage for extra help also. So the maximum they may have to pay is $13 for that.
Hmm. Okay. For the specialty drug. And for the rest of the, for example, the healthcare.gov plans, which
So
is,
right.
yeah,
So for healthcare.gov, if they have employer plan or healthcare.gov plan, probably Ozempic is in a specialty drug. They have to pay the co-insurance up until they reach the maximum out of pocket for their plan. So let's say if it's a single person, generally, generally for silver level coverage, their maximum out of pocket is between $5,000 to $6,000 maximum out of pocket. They may have to pay out of their pocket up until they reaches that.
okay, so
But
about,
for people who have commercial coverages like ACA or employer plan, and for some specialty drugs, there are some coupons available that you can contact the manufacturer and they can provide you with $0 or $10 or $5 30-day supply if you qualify for that also. So that is another option that is available for you.
okay. Okay. Okay, anybody else with that, any questions? Is it back?
There. I have a question for Moina. So if people who are allergic to some of the medications and they cannot change the formulary, what can be done for those kind of medications?
I don't think that I'm qualified to answer that because you're talking about disease or different medications, not the coverage. What they need to do is they need to contact their doctor and find out what is the alternate medication for that. There are generally different options available unless it's a specialty drug. Then you have very limited option to cover one disease or one symptom, but they need to contact their prescribing physician, and the prescribing physician can contact or they can suggest an alternate medication for that.
Are there any exceptions for the insurance companies for the people if they want to stay with a preferred generic, non-generic, and the overrules, or do you know anything about overruling of that or no?
Generally, if a generic, the general rule of thumb is that if a generic option is available, insurance will not qualify to you to get the brand drug for that. For any reason, if the generic is not working with you and you need to switch to brand drugs, I have a couple of clients with the same issue. So what they need to do is they need to the prescribing physician has to contact the plan, and the prescribing physician has to request them formulary changes to change their coverage. So instead of, even though the generic option is available, if it does not suit them, then the insurance can cover the brand drug. And again, depending on which option you have Medicare, Medicaid, or ACA or employer plan or commercial plan, you have to pay the copayment based on that for brand. But it will not be, generally, it is not that if a generic plan is available, but you are the generic prescription is available and you're allergic to that, and you need to switch to brand drug, you have to pay you can pay the copayment of a generic. You will end up paying a copayment of a brand drug for that.
Hmm. Are there any out of pocket, or are there any limits, or a particular dollar amount where that the extra help people, seniors, would end up paying for their medications?
Yes, so extra help, the maximum that they can pay for 30-day supply. Again, extra help, depending on their income, has different levels. They can pay from $4 all the way to $13 maximum for their brand drugs. Generic is generally $0 to $2 maximum. So, but they generally do not have the maximum out of pocket. People with extra help, because they are only paying maximum $13 a month, they will not reach that $2,000 maximum out of pocket for a year.
Yeah, but I'm thinking if somebody who has 15 different medications, and they do happen to be special, the branded drugs, and 15 different medications with $13 comes out to be $180 some on a monthly basis. So that's a lot of money for somebody who has Medicaid and still has to pay $180 for their entire medications.
Yes, unfortunately, that's how it is. Unless they qualify for a category, their income is less than 100% federal poverty level,
Uh-huh.
then they will not have to pay any copayment or
Oh,
co-insurance for their medication. Then it's $0 that they are 100% covered. They are called QMB individuals. They don't have to pay anything. But other than that, if their income is higher and they don't have full Medicaid, they only have extra help, then per medication for brand drugs, they have to pay $13. But again, most of the people have only couple of brand drugs that they take on a regular basis. It's if they are taking like 15 medications, not all of them can, in very rare cases, it will be that all 15 prescription drugs are a specialty drug or brand drugs.
Okay. Or they can make a lifestyle change to trying
Yes,
to get off the drugs, right?
definitely. The prevention is 1,000 times better than
That's
cure.
true.
Always.
And Shahina, does anybody else has any questions? I don't want to.
Yes, I actually have two questions. My first one for Sister Moina. Sorry if this is kind of redundant, but I think I'm just a little confused on the Medicaid portion of the maximum out of pocket. So how does that differ from the Medicare and the ACA? I don't know if you're able to go back to that slide, Malcolm.
Yes, if you can go back, please. One more. There. So if individual only have Medicaid, they generally do not have to pay anything for their medications unless the medication is not covered. Okay. So there is no maximum out of pocket for individuals who only have Medicaid. Maximum out of pocket is for people who are enrolled in Medicare plan, Medicare and Medicaid dual eligible, because then they have to pay that extra cost, or if they have coverage through their employer or Obamacare, which are called commercial policies. Then maximum out of pocket applies. Maximum out of pocket for under 65, generally for ACA or employer plan, is the maximum of their plan. And their drug, whatever they are paying towards their drugs, counts towards their MOOP. With Medicare plan, Medicare Advantage or prescription drug plan, which is a standalone prescription drug coverage for under Medicare umbrella, they whatever they are paying, an individual is pays towards their prescription drug does not count towards the plan maximum out of pocket. So these plans have two different maximum out of pocket, one for their medical and one for their prescription drug coverage. So this $2,000 is for their prescription drug coverage. Did I answer your question?
Yes, you did. Thank
Okay.
you. And then my last question was for Shahina and Fatima. On the salutogenesis approach, I'm wondering if maybe you guys have any examples of how that can be applied in terms of like medication or wellness management, just how we can apply that in a real manner.
Salutogenesis, I was explaining earlier, it's basically focus on prevention, education, and promotion. So depending upon whatever situation or whatever the circumstances are for an individual, they can follow salutogenic approach, which is focusing on the well-being. So I was giving an example like by making small changes in the lifestyle um, can improve your well-being. So, but if the things go in the other direction, like if those lifestyle stressors are not addressed appropriately, then it will go in the different direction, that is pathogenesis, which is basically disease, disorder, development. And yes, salutogenesis, if it's regard, like as we are asking about medication, it is going towards pathogenesis. Then it's not salutogenesis anymore. So you're working towards cure or prevention or protection. Sorry, cure and protection. So medication, if somebody is already has a disease or a condition, then it needs to be their health needs to be protected, and there is a need for the cure. So medication go that way. But salutogenesis is basically more towards prevention, education, and promotion of health. Did it answer, Michael, your question?
Yes, thank you.
Okay, you are welcome.
So when you are taking medications, it looks like you're already at the protection stage, right? Can we go back to that
Yeah.
slide? So if you're taking medication, you're actually at protection stage.
Correct.
So you need to do extra work in order to go back towards this positive health.
True.
Major lifestyle changes, right? Wow. So Shahina, when you talked about the readiness and the template of the readiness, can we go to that slide, please? The one more.
One more.
This one, do you have tools like maybe questionnaires or maybe how there could be a checklist where that would help with each stages that we
Yes,
could
definitely.
perhaps do
Yeah.
we?
Yeah. There are questions that it's basically called motivational interviewing. So
Okay.
yeah, so we are assessing somebody like where they stand in the process. So we do ask questions, and then the person needs to decide themselves. Like they need to assess themselves and figure out where do they stand. Because as I was telling earlier, behavior change is not something that can be forced upon. It has to come from within. The person needs to be ready themselves to make any small change, any little change. They need to be ready themselves. So they need to identify where do they stand, what quality they need to focus on, what are their barriers, and how do they plan to overcome those barriers. So yeah. And one more thing I forgot to mention, find your support system. That's very, very important. Maybe it could be a family member. It could be a friend. It could be yourself also. I find out what supports you, and be ready to do your self-assessment, during the journey, many times during the journey, because that helps, focus on the goal and the direction.
Okay. Any other last question? Anybody else? So if nobody has any last question, can you go to the last slide, please? If we don't have any last questions, thank you. I thank everybody for listening. And do we have an information slide where they can get back? Yeah, so stay tuned. Yeah, you can capture these. There is a slide here at the QR code. Whoever is present, yeah, thank you. So if people want to stay tuned, they can join our WhatsApp group for the volunteers, and you'll get to know about the volunteer opportunities, and also our announcement group where you get to hear all about our announcement as to what types of programs we are coming up with. So stay tuned, and we will see you at the next webinar. Thank you.
Thank you, everyone.
Thank you so much, Fatma.
And our special thank goes to our speakers and our organizers here. Thanks.
Yes, thank you.
Thank
Thank you,
you.
everybody.